right away. So just knowing the basics about COVID-19 is important. I know that we've been in this pandemic for almost a year now. And so it's one of those things that we know some things about. As we go along, we're getting more information. So we're just going to continue to kind of update that information today, review some of the things we know, and then kind of add on to things that we're learning over the last year. So what is coronavirus? What is COVID-19? A virus in itself is kind of a small infectious parasite. So it actually requires that it attaches to something living, someone living, in order to replicate and continue and live. So they have to get into a person for this to work. Now, coronaviruses are normally just regular viruses that cause you to have upper respiratory infections. They're usually mild. They're not that problematic, but in this case, COVID-19 has several more issues than most common coronaviruses. Just an update, it is zoological, so that means it's come from animals. So bats are some of the things that they suggest that it can come from, but there are several animals that carry viruses. And the issue with COVID-19 is that it's a novel virus. So what that means is that it's new to humans. So we've never had to develop antibodies against it before. And so when a person is infected with coronavirus, they're having to build this from the beginning. And so that's what it makes it a little bit more dangerous for us at this time. So just a brief physiology. Most cases of coronavirus are contracted by inhaling droplets, respiratory droplets, or aerosols into our lungs. And once the virus is into the lungs, what it does is it has several proteins, but one in particular actually attaches to our pulmonary cells. So it attaches to the lung cells. It injects this virus, and then it actually reprograms that cell to replicate the virus. So in essence, it's turning our own body cells against us. And so initially, some of the studies that they've done, but they're not able really to prove it, is that patient severity was related to the initial viral load. So if a person, for instance, was very sick or they had to be intubated, that was when they had to stick a tube in to help them breathe. Medical workers that were exposed to that initially had really severe cases. So what are some of the symptoms? This is what's tricky about COVID-19. About 20% of people will have no symptoms. And so that's one of the reasons that we encourage, masks and those things like that. But so 20% of people will have no symptoms. But for those that do develop symptoms, it's usually coughing, fever and chills, congestion, just kind of the flu-like symptoms that you see, headache, sore throat. You can have the vomiting and diarrhea. Probably one of the most unique symptoms of COVID is that people are losing their taste and smell. So I know some people that have actually presented to the ER just saying, I couldn't smell my soap this morning, and then they have the disease. You can also have some atypical symptoms, like in the elderly, they may have weakness or they may have confusion, which is something they normally don't have. And then you can also have chest pain or shortness of breath, which are indicative of possibly worsening symptoms. So why is it concerning? Because in COVID-19, some of these people that develop basic symptoms. I know that Key was talking about that there were people that recover and don't have issues, but a lot of people can go on and develop pneumonia. They can develop a respiratory distress syndrome. Concerning for a lot of parents is there is the MIS-C and an MIS adult version, or MIS-A. These are multi-system inflammatory syndromes, and they can actually affect children and send them into that cytokine storm, which can sometimes disable the body and affect organs. And that's where you worry about deaths that are occurring, especially not very many, but some in kids. And so that's a concerning syndrome about that. Another thing that we have seen is that even younger adults in their 30s, they're presenting with strokes. or heart attacks that have had recent COVID symptoms or been diagnosed with COVID. They can also have risk factors for pulmonary emboli. That's where you have a blood clot that goes to your lung. And then you have some people that have like a post-COVID syndrome. So that's when they have still some struggling with respiratory issues and breathing. And they also have some fatigue symptoms or feeling weak and tired after having COVID. So there are several people that suffer from that as well. So what are some of the risk factors? I did not list race as a risk factor because a lot of these are somewhat confounding in that, sometimes African Americans suffer more from obesity, from hypertension and diabetes, and all these are considered risk factors for more severe disease in COVID-19. But it is documented that African Americans are dying at 2 times more than Caucasians when developing or when contracting COVID-19. So that's one of the reasons we're doing this talk today, is because we want you to be aware of what makes higher risk and when you need to seek treatment or preventive measures to help prevent getting the disease to begin with. So how is it spread? Yes, we talk about that contact with contaminated surfaces, maybe touching your mucous membranes with your eyes, your nose, your mouth, or ways to spread, but that's not the main way that it's spreading. It's mainly through respiratory droplets. So if people are sneezing or coughing, we've got documentation where people have been singing together and then they develop COVID, or just talking and laughing, or one of the studies that had CDC and the NFL, they actually spread it by eating together. So this is something that we have to consider, as much as we love eating with our family and our friends, that's one of the ways that it's spread. Now, a few studies from China also show that there was airborne spread. So they're saying that the virus can live in the air up to 2 or 3 hours. And so they had documented evidence from spread in elevators, as well as in restaurants, when someone infected with COVID was near an air vent, and they actually spread it to other people in the restaurant. So as you look at him, I'm not actually going to show this video, but you can see how he has the germs on his hand and that he didn't realize that he had been just messing with his face and touching his face. And it's just to emphasize that it can be easily spread, and to make sure one of the mitigating factors we talk about is washing your hands, and we'll go over that very briefly. Oh. This gentleman here, I was going to try to show just a brief part of this. This shows how those respiratory droplets travel, anywhere from 3 to 6 feet. And we don't want to spend a lot of time bogging you down, but my sons were so impressed with seeing how far these respiratory droplets spread that they are more conscientious about wearing their mask. So if you'll look at this, this is just an example of seeing the respiratory droplets. And that kind of stays with you. That's 3 feet away. That is 3 feet away. It said 1 meter. That's about 3 feet away. And so if you don't have on a mask, that actually got onto somebody's face, their clothes, some on their arm. So I didn't really want to subject you to that, but it makes you think about, this is what happens when people sneeze and they're not covering their nose or they don't have that mask on. And each one of those droplets contains thousands of viral particles that can infect you. So it's important, if we can, to prevent the spread. And so some of those mitigating factors we talked about are making sure that you're washing your hands or you're sanitizing your hands frequently throughout the day. We do suggest washing with soap and water for at least 20 seconds. Also, if you can avoid touching your face, rubbing your eyes with your hands completely. Sometimes at work, I just grab tissue and wipe my eye if I need to do that, just so I'm not touching it with my hands. Even though I know I've washed my hands many times, you just don't know about all the surfaces that are there. I guess we've gone over the 3 W's: washing your hands, wearing a mask, watch your distance. So in wearing a mask, they do recommend that you wear a mask that comes over your nose and that it has a good fit against your face. and that you should be wearing it at all times when you're outside of your home around people that are not normally in your home. Now they have mask mandates even in federal buildings. And more recently, in January, they have done studies that show that double masking, if you're able to tolerate it, is actually more effective than a single mask. So if you had a surgical mask and then you wear a cloth mask over that, it's actually more effective, almost 2 times more effective in preventing both droplets going out and helping in filtrating some of those droplets to protect you. They're also showing that the humidity in the mask that builds up actually has a protective effect because it helps your ciliary, which is kind of little hairs in your respiratory system, keep clearing out mucus and viruses and help actually to prevent against the spread. And then, of course, wash your distance. The NFL, like I said, they did really high research, and that most of the people that got it from eating, meeting, riding in cars with people. So they really recommend 6 to 10 feet. If you can be, especially if you're working out where you breathe heavier, that type of stuff to prevent spread. They also noticed that if people spent, whether it was a consecutive 15 minutes or cumulative 15 minutes in a poorly ventilated area, like in a car or in an elevator, those had higher risk for developing COVID. I just say in prevention, if you start noticing any symptoms, that you should get tested immediately, and then quarantine appropriately. Usually it's 7 to 14 days, just depending on when you were actually diagnosed and when your symptoms started. And I think one of the questions that was given to us was, where can you get a free test or a drive-through test without an appointment? Baptist Health facilities, as well as UAMS, they have drive-through services where they will screen you. So if you're having symptoms, they will test you. Okay, they will test you for free, but they might want information about you, like your name and phone number and date of birth. How am I doing on time, Key? Okay. Okay, all right. And also the VA offers these services as well, but it's just for veterans, but they will offer free drive-through testing if you have symptoms or a known exposure. Now, this is one of the things I wanted to cover really fast. It's just talking about updates for children and athletes. So one of the things that people were concerned about is sending your kids back to school and knowing that kids don't always wash their hands like they should, that they're rubbing their noses. They're not always the cleanest people in the world. But the CDC has a recent study that suggests that kids are not sufficiently passing it in classrooms when mitigation factors are followed. And that's in classes where they were wearing masks, they were actually socially distanced, at least 6 feet apart, and that they had frequent sanitation and hand washing. So that was the current recommendations, is that in-person learning was not spreading it sufficiently, that the kids that most likely got COVID got it from home or from family gatherings, friend gatherings. As far as the American Academy of Pediatrics, they are recommending that kids that are athletes wear masks in most sports. So they're saying if you're playing basketball, you should have on a mask. If you're, playing football, you should be wearing a mask. The few exceptions that they made were kids that played golf or tennis, because they were kind of individualized, and also if they were wrestlers, because the mask created a choking hazard. But they do recommend masks for sports, not just on the sideline, but during the activity itself. Also concerning sports and COVID-19 with kids, they do recommend that kids get a physical, including a heart evaluation if they're treated for COVID or if they've been diagnosed with COVID. A study last September showed that several athletes, as many as 15%, have no symptoms initially, but they do have something called myocarditis. So if they get to where they're doing an activity with myocarditis, they can actually go into a rhythm that could kill them. And so that's why it's important that kids are cleared with a heart evaluation before returning to sports, just to make sure that they can be safe in that. And of course, why are we doing all these preventive steps? Because primary disease prevention is what we prefer. We prefer that nobody gets the disease. So that's why we're trying to do the preventive steps. But we also, of course, want to limit the spread to others. We wear a mask because even though 20% of the people have no symptoms, those 20% have been shown to actually cause 59% of the transmission because they don't have symptoms, and so they don't think they need to have a mask. But everyone should wear a mask because, you know, we're just not psychic. And of course, this is all to help our community to get back to a somewhat normal existence again. And once again, I think he went over this, but you know, at this time, after a year, we've had almost 500,000 deaths in America. 28 million people in the US have had this. And the symptoms can range from no symptoms, asymptomatic, all the way to people that are in the ICU or even death. Most of it is spread by respiratory droplets. So that's why mask wearing is important. Hand washing and social distancing can all help to prevent that. Thank you.